Better Together podcast.
Welcome to the Better Together podcast from the Fuquay-Varina Chamber of Commerce. We're recording today from the Dashmore Conference Room and Studio, sponsored by Rescued Wood Rehab. The Better Together podcast highlights local businesses each week as the Fuquay-Varina Chamber of Commerce continues to promote an amazing business community. I am Marty Woodward from Rescued Wood Rehab, and I'm joined by my co-host Brad Marshall from Greater Culture CrossFit here in Fuquay-Varina. Brad, how the heck are you?
Doing really well this week so far. How about yourself?
I'm doing good. I'm excited about our next guest.
I'm very excited as well. I'm excited because I think there's a lot to learn here in an industry I'm not as familiar with. We have Barbara Patterson. She is the regional director for Arosa Care, which does a lot of home care. And so, Barbara, thanks so much for being a guest on the podcast today.
Thank you for having me. I'm excited to be here.
And we were chatting just before we hopped on the podcast. You were educating us, which is always helpful around this idea of home care and what Arosa Care is all about. So tell us a little bit about Arosa Care and what you all are all about.
Absolutely. So the name is a little confusing sometimes. Our name comes from our CEO. His grandmother lived in Arosa, Switzerland. And so for him, it's always been very significant and important. So that's how our name, Arosa, you don't necessarily think home care. Home care, we've been around 25 years. And our goal is to go into the homes and help keep seniors independent and in their own home as long as they can actually stay there. Sometimes there is a need to move to a facility, and we support people in facilities too if that's where they choose to be their home. But we really want to keep them as independent and doing as much as they can, healthy, happy, as long as possible.
Yeah, and I think anytime you can keep somebody independent in their own space, it's always a fantastic thing. And so getting into the home care, been in it for a little over a decade now is what you shared with us. So what got you either interested or intrigued to get into home care and start working in that industry?
Funny story, I kind of fell into it. Never thought I'd be in any kind of care role because needles and blood, all of that. I was like, no. I was a banker in my first life. So I fell into this through the hospital in the case management department and really had my eyes opened as to the world of senior care. Facilities, rehab, how many of the same people came back and forth to the hospital with readmissions, the issues they faced, and just the not lack of resources. There are tons of resources, but we don't think about those resources until we're in a crisis. And so I've learned so much, and I think with Arosa, as we have grown and expanded as a company, our goal is to teach people while they're your age, to help you prepare with your parents, but then more importantly, to help you prepare with yourself, of knowing what's available, what's not available. Listen, we need a life plan. And so to help people start thinking about that before they're in crisis.
Yeah, and I imagine, you mentioned crisis usually comes up, challenges that
Yes.
people are facing. And so as you've gotten into this industry and continue to educate and help people understand, what are some of the challenges that you've seen, whether it's, individuals looking for help or assistance with maybe some of their loved ones, or even loved ones, or an individual who's like, I need some help to figure out and navigate life at home. What are some of the challenges you've seen in the industry?
Well, the first challenge is nobody ever wants to have somebody come into their home to help them. So that admittance of I need help, that's a big hurdle. For a lot of people, they feel like that is saying I'm no longer independent. So that's a big battle. We see children who are doing everything for their parents, and the parents who don't realize that their independence is because their child is coming in 3 or 4 times a week. So we do a lot of, I call it mediation, of really let us be the bad guy, let us sit down with the families, let us talk about the reality of the situation. And sometimes that's talking about the kid, and do you realize your child is working and they've got kids that are in sports, and so a lot of education, a lot of consultations with families of trying to get to the root of the situation and how everybody can walk away feeling supported. So that's a big problem. Another problem is, you've probably heard healthcare shortages. There's a ton of shortages out there today. So finding amazing caregivers to work with our clients is, will always be a struggle. And it's not just home care, that's in the hospitals. That's in the rehabs. That's everywhere across the board. There's a tremendous shortage in healthcare.
Yeah, I mean, just, yeah, the ability to admit, hey, I need some help, or somebody can come and support me. That's such a challenging piece of it. Then you mentioned that Arosa has, over the year, kind of changed and taken on different formats. What are some of the unique aspects of Arosa that make you unique in the industry here?
Absolutely. So from day one, what set us apart 25 years ago is that we did private duty nursing. And so a lot of people never need nursing, but for us, medication management is a huge piece. So many people have to go to an assisted living because they're over-medicating, they're under-medicating, they can't manage them anymore. And listen, it's hard. My mother-in-law lived with us the last 2 years of her life, and I tried to do her med box, and, the exact same medicine, the pills look different. So I'm, scrambling, and I've been doing this a long time. So it's complicated. And then you throw a little bit of cognitive decline in there, or a diagnosis of early dementia, and it's hard. So nursing can help with the meds. We do a lot with home health. So home health helps you when you come home from a rehab or hospital. It's a physical therapist, a speech therapist, an occupational therapist, and there's a nurse who oversees that. Insurance covers it, so it's amazing, but it's a very short duration. And insurance is only going to cover for 1 or 2 nurse visits. So wound care, a lot of people, if they've had surgery with a big wound, if they've had to have an amputation, our nurses can help supplement what home health is doing. And then the care management, that is the newest thing that makes us different. And it's kind of interesting in this day and age because every company, hospitals, doctors' offices, rehabs, everybody has a care manager. They don't have a care manager like Arosa. I think if I described it, it's kind of like we are that boots on the ground substitute family members, because so many families are stretched across different states, and gosh, we even have a lot out of the country. They're in big jobs, and we can take their parents to a doctor's appointment. We had one locally. There was a storm, a tree came on the house. Our care manager helped get the insurance policy going, contracted the person to come do it, stayed with the seniors while all this was going on in their home. So we can do a little bit of, if it's legal, we can do it. Get people out to art classes. One of our care managers took someone to like a llama farm, and she got to play with the animals. So it's quality of life, as well as quality of healthcare.
Yeah, it's interesting. You mentioned a lot of the different services that you offer. Talk to us about being that advocate for, say, my parent is going through something. What is that? What does that look like? Being the advocate for a parent who might be in the hospital or in some sort of a care facility. How do you approach that?
That's a great question. And I tell people, even if you're a professional in the healthcare, when it's your loved one, you're in it emotionally, and that it takes a toll on you, and you're not the same advocate you would be for a stranger. So what that advocacy looks like, a lot of times as we age, and I can personally attest to this, your doctor list goes from 1 to a couple. And so coordinating appointments, so many times, they get the little note from the doctor's office, it never gets on the calendar, they don't schedule a ride to get there, and those appointments fall through the cracks. So that's one way we help advocate, is making sure that all of the appointments are monitored, recorded, and attended, but communicating between the doctors. My chart is amazing. I'm with Rex and UNC, Rex and Wake Med, so 2 different my charts. So having those conversations between the doctors and making sure that what Dr. A wants done is an agreeable, a good solution for what Dr. B is trying to accomplish here, and that it all aligns and everybody knows where they're at. So that's a huge step. Sometimes there's other solutions than what your doctor recommends. And I'll give you an example. And this is where my passion comes through. We had a call from a family of a 92-year-old woman who needed nursing because she had had a mastectomy and had all these drains coming out, and the family needed support with that. So my first question was, at age 92, did somebody give her options, or did they say you have to have the surgery? Because you have options. You don't necessarily have to have surgery at age 92. And if she was given options and she chose that, I fully support and applaud her decision. But if somebody in a hospital said, this is next step, we got to get this done, and your surgery's scheduled for tomorrow, that makes my blood boil, because she should have a right to make her decisions. So that's what that advocacy looks like to me. It's not always what the doctor says. There's usually other options.
Yeah, and I think having personally gone through some of those decisions or been an observer of some of the decisions, it's very difficult on families to know what to ask and know what to do and what those steps look like, whether it's going toward a rehab facility or whether it's going to maybe a hospice situation.
Absolutely.
And from an advocacy standpoint, you guys kind of have to walk through those steps with not only the person involved, but also the family members who are, they don't want to give up sometimes, or they want to, prolong things that might be inevitable. Does that make sense?
Yes, absolutely. So that question made me think of a couple things. First of all, in the planning, we really do try to talk through, do you have a living will? Do you have a healthcare power of attorney, a financial power of attorney? A lot of times we see husband and wife, and they're each other's. But you have to ask the question of what if, and have backup. So we do serve as a backup for healthcare power of attorney for some clients. And then the resources, so, navigating going to a rehab. We know the process, we know the procedures, and that's where our professionalism comes in. We have relationships in the healthcare community. So a lot of times hospitals, like, the only bed that's open is A. Well, we can get on the phone and call B and C, because it's constantly changing. They're constantly discharging people. And if we get the hospital to hold them one more day, then they can go to B. So that's where sometimes our advocacy comes through. B is close to home. B has an amazing reputation. So we can help them fight in ways they never knew they could fight.
We're talking about topics that a lot of times people don't want to talk about, right? They don't want to talk about this. And I've been lucky enough, and I've actually got friends who've gone through things and I've witnessed those things. And I guess I've become a little more comfortable in talking about our trip toward death, which is going to happen for all of us.
Yes.
And so how do you get out there and educate people to have those conversations and bring up those things? How do you get out there and educate here in the community?
Absolutely. I mean, it's a tough, if I ask you about your end of life, you're thinking, what do you know that I don't know? What did the doctor tell you? Are you wanting my money? Are you trying to kill me off? Right. But really, it's about quality of life. And everybody has a choice. We see people all the time where they've put in a DNR, a do not resuscitate. Actually, my husband and I were watching a TV show last night about a hospital, and the daughter was dead set against, she wanted her dad put on a vent. So there's nothing wrong with having those conversations. We're all going to die. We're all going to end up in the hospital, probably. So what do you want that to look like? And ignoring it is not going to make it go away. So let's talk about it, and talk about it with professionals who can help you evaluate your options. And it's your choice, but you want it to be your choice and not some doctor who's never met you. And you also don't want the scenario where, if you haven't talked about it with your family, of your son wanting to honor your wishes and your daughter saying, I never knew that was the wishes. And then them battling, because you can go to battle in the hospital and it has to go to the courts and things get drawn out, and it can be really messy and can tear a family apart. Mm-hmm. So I think education and being empowered with your own decisions is the best thing we can do.
Yeah, and I think having opportunities to share conversations, even like today, certainly go a long way to helping that. And I imagine with being involved in home care now for over a decade, there's probably a lot of lessons that you've learned. Are there any best practices or things that you might share with somebody as, hey, here's some things I've learned, some lessons that might help you navigate the path or help you as you think about what using home care could be like?
Absolutely. I think the best lesson is you're never too early. It's never too early. You're never too young. The more you know, the better your decisions will be. So that would be one thing. Having hard conversations, and again, bringing in a professional. I will tell you the greatest gift my mother gave me is when she passed away. She was very organized. We open a file and there's everything. Scripture she wanted read. She had poems, and she even pointed out which grandchild, if they were old enough at the time to read it. She had changed from wanting to be buried to wanting to be cremated. Everything was laid out. So for us as a family, we didn't have to worry, am I doing what Mom would want? Am I making the decisions that she would want? She had done all that for us, and we were able to respect it.
And those things are documented too. That's another key factor, that you have documentation taken care of, whether it's a will or whatnot, or the power of attorney for someone else, and all those things. It's documented. That's a big thing that helps you guys, right?
Absolutely. And conversations. Listen, I met with a couple, and they had appointed their daughter as the power of attorney, but hadn't told the sons. And so, I sat down with them, and I'm like, I understand why you're making the decision, but you need to have that conversation. Don't wait till you're in the hospital, and then your sons are going to be upset. Let them know why you made the decision.
Yeah. And I mean, Arosa, getting out into the communities, getting out into people's homes, obviously, for the work that they do. When you think about your involvement in trying to get out into the communities, whether it's events, initiatives, or ways that you're trying to partner with other folks, are there anything that come to mind for you as the way that Arosa is working to get out into the community to share?
Listen, I think Arosa, we are so heavily dependent upon the people who work with us. So yes, I can give you examples. Listen, I partnered with Dementia Alliance. We started, I'm a co-facilitator for a dementia support group at the United Methodist Church here in town. One of our care managers, she's on the board of Guardian Angel, and so they help support dementia and make donations for research. We're working with the new senior center. We're in the ground laying of trying to open a dementia cafe there. So it's each of us finding something where our passion lives. Joining the chamber, I just met with Mary Elizabeth Twitty, and we're going to do a seminar at the end of the month, or end of February, to educate people on how you can be prepared and why you should be prepared. Met somebody through the Lions Club, Mr. Wayne Lutz, who happens to be, the president now of the Lions Club, so got to go in and speak with them on the exact same topic of, being prepared. So I think every relationship, every person we meet in the chamber has been a gold mine for that. We just want to help the people in the community.
Yeah, and I think anytime you can get out in the community, get involved, you start to realize and meet people you didn't know who can help and support you and open up new doors or have access to different populations that you never knew that maybe are going to be helpful for you or helpful for them. So it's awesome to get that cross-pollination and get a chance to meet so many other people.
Absolutely. And if you're making a referral, you want to make it to somebody you know, and they're going to take care of them just like they would their own family member. So I think relationships are important.
Mm-hmm.
That's tremendous. So, being a part of the Fuquay-Varina community, do you have a favorite local spot or spots that you like to go?
So my newest favorite is Zira's. I had never had Indian food, and so one of my coworkers, she's like, we need to go. Like, I wouldn't know what to order, and that buffet is just amazing, and the food is amazing. Garibaldi's for my husband and I.
Oh,
That's our date night.
Oh, yeah.
Yep. That's fantastic. Both of those fantastic places.
Great. Both. Now I'm getting hungry now, Brad.
I know.
We gotta start.
It's getting to be about lunchtime. I know.
Yeah.
Leading into lunch. I highly recommend Zira's.
That's awesome. That's awesome. Is there a best piece of business advice that you've ever received?
Gosh, I'm old, so I've had lots of great advice. I would say my newest COO, I love her. Probably feel the most supported I've ever felt with a boss. Her big thing is to be professionally demanding, and that has hit me in a way. I'm a softie. I love to nurture and support. So being able to flip that to professional demanding has been pretty life-changing for me. We can still be loving, but set good professional expectations. So that's my newest.
Sometimes having those hard conversations when you're someone who wants to hug someone, but you have to be direct with them it's a tough thing.
Yes.
And it kind of fits right into the whole topic of talking about your future needs and when death approaches. Yes. So, is there any surprising fact about Arosa that maybe we wouldn't know? Anything that just kind of pops to mind and says, "Oh, you wouldn't believe this."
I'm going to write a book someday of all of
yeah.
Listen, I think when I think of Arosa as a company, I think the surprising thing is it starts at the top and it flows down. And our CEO, listen, when I interviewed with him, I told you needles, all that, never thought I'd be in healthcare. He wanted me to go get my CNA certification. And I mean, we had many, many meetings. I'm like, I hear you, I appreciate it. No. When he bought the company, he went and got his CNA certification. And he still covers shifts. I can't tell you how many times on Mother's Day he'd call me and say, who can I go relieve so they can go home and be with their family? We had a snowstorm once years ago, and I don't drive in the snow, and I had a call out on a Sunday at like 5 o'clock, and I knew I was not going to get anybody there at 8 p.m. And he met my husband. He drove me. He'd made me a goodie pack. That next morning at 6 a.m., he's there to relieve me. He had an Uber for me, and he stayed with a client till like 10 that morning when the next caregiver could get in. So I think that's the surprising thing to me. It's why I'm here. You just don't find that at your top level of leadership, and it trickles down through every level at Arosa.
Yeah, it's amazing to have that be the standard and the expectation, and then to follow through and to have that consistency is fantastic. And so for folks who are interested to either connect, learn more, receive better education on home care, what are the best ways that they can get in touch with Arosa?
Listen, we're right across the street from Chick-fil-A here, so you can stop in and see us. Our website, if you just Google Arosa, we're there. It lists all of our locations. Or you can call us, 919-309-4333.
That's fantastic. So definitely check out the resources, the tools, all those things that can help make some of those really challenging moments in life maybe a little bit easier for you.
Absolutely. Any way you need help, pretty much we can help you.
And then you mentioned a few things around the Chamber of Commerce. We always love hearing from members the highlights and the things that have been meaningful and impactful, what it's meant to them to be a part of the Chamber. So thinking about Arosa and being involved with Fuquay-Varina, what are some of the benefits or the things that you've enjoyed about being a Chamber member here?
Listen, personally, I've lived in this area for 30 years, but I never worked in Fuquay. And so when Arosa and Centerpiece there on Main Street merged 4 years ago, that brought me into Fuquay to work. But, you know, if you don't know people working in the community, it's starting at ground zero. And the Chamber just made it feel like home, you know, making easy connections. You walk into meetings, people welcome you. You know, the breakfast last time, Christy came up and hugged me. I mean, I feel like I'm part of this working community now. And I owe that all to the Chamber and the people that I've met.
Yeah, it really is an incredibly welcoming community, and it makes it feel like when you walk in somewhere, there's a warm, genuine care of like, hey, how are things? How can we support you, and how can we grow together? Which is, I think, is just such a fantastic thing. So,
Absolutely.
Well, Barbara, thanks so much for joining us on the podcast today and representing Arosa Care and the home care. And I learned a lot around home care and how we can continue to support folks who have some of those needs, especially as medical challenges arise. So thanks so much for being a guest on the podcast today.
Thank you so much. I appreciate it.
And thank you to our listeners. Join us each week on the Better Together podcast from the Fuquay-Varina Chamber of Commerce as we highlight a great local business. From the Dashmore Conference Room and Studio, sponsored by Rescued Wood Rehab, I am Marty.
And I am Brad.
And we are
Better Together.
We're better together. It's a weekly podcast. We're better together. You should know that there's more in the dash. We're better together. Fuquay-Varina Chamber of Commerce. We're better together podcast.